Good afternoon, and welcome to today's caregiver webinar, Oral Health Techniques for Caregivers. My name is Allegra Jaffe, and I am the supervisor of the Caregiver and the Supportive Service Unit here at the Fairfax Area Agency on Aging. A few housekeeping items before we begin today's session. Today's presentation is being recorded. A link for the recording of the session will be sent to all the registrants by next week. You should have received the slides this morning, but we will send the slides again with the recording. We have enabled closed captioning. So if you would like to enable the closed captioning, you can turn them on the bottom of your Zoom panel. We also will have Q&A at the end of the session. So at the end, you can type in your questions on the Q&A. We do not have chat enabled, but you will use the question and answer box, and we will speak with the doctor at that point. And lastly, there is a quick survey at the end of our time together. If you could please take a moment to fill that out, it really does help us make relevant programs for our family caregivers that are interesting to you. And now I would love to introduce our speaker, Dr. Rosa Mathai. Dr. Rosa Mathai, DMD, is a general dentist in a private practice in San Francisco. She was formerly the chief of house calls with the house calls dentist and on staff at Kaiser Permanente and CPMC hospitals in San Francisco, providing dental care in their operating rooms and emergency care to inpatients. Dr. Mathai's clinical experience spans nearly a decade of practicing safe and comfortable dental care for geriatric and special needs adults, especially those with complex medical needs. Thank you so much, Dr. Mathai, for being here with us today and sharing all your knowledge, and I will let you take it away. Thank you.
Thanks for having me. Let's see if I can get that PowerPoint up. All right. So yes, this is Oral Health for Caregivers. Thanks for the intro, Allegra. I'm a currently practicing dentist in San Francisco with an interest in being able to enable healthcare for all adults, especially those that are homebound. In a past life, I did do house calls with dentistry, and I was on staff at a couple of Bay Area hospitals treating adults with special needs. A lot of patients who would be brought in who needed sedation for dentistry, particularly those who are homebound. And so I've worked with a lot of home health facilities as well as people like yourselves, family members of people who have become homebound or maybe developed dementia and need a lot of help with their dental care. So as a caregiver, you have a lot on your plate. And specific to this presentation, I want to just have some objectives laid out, some goals that, everything I say in this PowerPoint is probably not going to apply to you or everyone, but I want you to be able to take away some things that could be valuable in your practice. I want more than anything for you to understand your role in maintaining your loved one's hygiene and oral hygiene, even if they don't seem to express a need for dental care, which is pretty key. And I want you to understand what is good oral hygiene and what is a good, healthy mouth, and understand why that's so important, not only for your teeth, but also for maintaining good overall bodily health. I'm going to review ways to clean your teeth and also help you recognize when you need some outside help. When do you need to get involved with a dentist or even a physician and a hygienist, and give you some tips and tricks on how to get that care, because that can be a big challenge. So overall, there is a growing demand for dental care among seniors, although there are still huge issues with quality and equitable access to care for dental care for most people. Overall, more adults are aging with their teeth or teeth replacements and seem to value their teeth and oral health. Even if you're not perfect or you don't do it every day, most people have an understanding that you're supposed to see a dentist from time to time. You're supposed to brush your teeth with toothpaste. And those little things, as public health measures, have really helped adults age with more teeth today than they did in many decades in the past. And those older adults, as we all know, are very diverse. You know, people who are homebound now suddenly are tasked with taking care of their teeth despite not being able to get to the dentist, for example. And this graphic is from the Census Bureau. It just demonstrates, again, how we're aging in this country. And the cohort of those adults age 65 and over is only expected to grow. And with that growth, of that population, we can also expect a growth of yourselves, people who are now caregivers. So, with all the other things you're worrying about as a caregiver, why should you worry about teeth? There's several reasons. Teeth are necessary to eat. You technically can get by on a liquid diet, but it's not the same as being able to chew your food. The consistency of your food matters in terms of your ability to eat and enjoy yourself eating. Chewing specifically is linked to satisfaction. And when you're satisfied when you're eating, you're able to better provide nutrients to yourself. It's linked with lower stress, increased cognitive function. And so, in a nutshell, it's something that we would hope that all of us could chew and eat and enjoy eating and well into old age. Teeth are also a major part of your face. So without teeth, your verbal and nonverbal communication is affected. If you've noticed maybe someone without teeth, the lower half of their face might seem a bit collapsed. You're less able to emote. The position of your teeth directly influences how you speak and pronounce words. So without teeth, you're unable to communicate. And then behavior changes could be a result, especially in maybe a not as communicative loved one, someone with dementia. A painful tooth could lead to changes in behavior due to discomfort. And teeth are also part of your body. And importantly enough, good overall oral health is necessary to preserve general health. And that's because your mouth is an organ in your body full of organs. And it's a major portal of entry for things from the outside world, both good and bad, to the inside of your body. So there are a lot of links demonstrated. Decades of research have shown that there are diseases, especially chronic diseases, that are linked to oral health, poor oral health specifically, like heart disease, pneumonias, diabetes, and even Alzheimer's. And on the flip side, changes to your body also have effects that can affect your mouth. Say someone you know has had cancer and required radiation. That radiation therapy can change the quality and nature of the saliva in their mouth, making it uncomfortable to eat. It could lead to strictures and stiffness that makes it uncomfortable to speak or chew. Xerostomia is the clinical term for dry mouth. And dry mouth is one of the most commonly listed side effects on medications that your loved one might be taking one or more of. And when your mouth is dry, it's uncomfortable to eat and it leaves you more vulnerable to dental disease, something I'll get into later. Specifically, these chronic bodily diseases are typically linked to gum disease or periodontal disease. So, what is that? Your body starts an inflammatory process in response to bacteria and dental plaque. Dental plaque is the byproduct of food that you eat that gets broken down by bacteria in your mouth. And ideally, it's a soft white substance that you can brush or floss away on a daily basis. But if it's allowed to organize and linger there and not removed, it solidifies and hardens into something we call tartar or calculus. And it's a bacteria-rich structure, bacteria that your body does not like, and it tries to fight. And that fight leads to destruction of support for the teeth, destruction of support for the structure surrounding the teeth, specifically the gums and the jawbone. So the gums will swell and recede and may be painful. And the jawbone that anchors the roots of your teeth starts to melt away and cause teeth to loosen. And it's unfortunately very prevalent. a majority of adults that are seniors suffer from some form of periodontal disease in at least one area of the mouth. And the reason that's not great is because that is, again, harmful bacteria that is chronically sitting around in the mouth and seeding to the rest of the body. And also, your body is continually trying to fight that infection. And when your body's in that type of heightened inflammatory state, it releases mediators that, again, go to the rest of the body and can wreak havoc there. Specifically with heart disease, we see with people with severe gum disease that they have an increase in the risk for cardiovascular disease. The gum bacteria actually causes atherogenesis, which is the hardening of the walls of arteries in the rest of the body. And we see that those bacteria directly invade artery walls, and also the inflammation I discussed caused by that fight against gum disease waged by your body leads to chronic infections and inflammation in the artery walls as well. Diabetes and gum disease is probably one of the best understood and best studied correlations between systemic health and oral health. People with uncontrolled diabetes have a higher chance of developing gum disease. And on the flip side, the more gum disease you have as a diabetic, the more diabetic you are. That chronic inflammation from the gum disease is linked to insulin resistance. And this means things like your ability to control your blood sugars is reduced. Markers like your hemoglobin A1C levels tend to be higher. One thing we do see, though, as a positive, though, is that if you treat gum disease as a diabetic, say by getting a good dental cleaning, maybe taking an antibiotic on top of that, that targets the gum disease bugs, you do see improvement in things like hemoglobin A1C. So good oral health is a positive in this case for treating a systemic disease or bodily disease like diabetes. As a former hospital dentist, aspiration pneumonia is something that I was uniquely aware of. Hospitalizations due to pneumonia are a big chunk of the hospitalizations we see in this country, and they can be more deadly for people who are older, who have impaired swallowing, for example. And in particular, we see that there's an increase in the mortality rate due to pneumonias in those with dental disease. I mentioned something here about a periodontal pocket. That's just a way of measuring and quantifying how severe gum disease is. So those with even mild gum disease tend to have a poorer outcome after having pneumonia and a hospitalization due to pneumonia. As a hospital dentist, I would get consulted by infectious disease doctors who would culture the bacteria in, say, a lung infection and find out that the bacteria there is stuff that's supposed to cause dental cavities, not a lung abscess. And the theory is that, say a chunk of tartar buildup or a broken piece of untreated dental decay, that bacteria is aspirated and inhaled into the lungs. And in someone with bad oral hygiene, that's a little more likely, or someone who can't swallow very well, or someone who's lying down and has an impaired immune system, that bacteria is then allowed to take advantage of that and seed and become a life-threatening emergency. So again, minimizing the bacterial load in the mouth is going to reduce that risk. And there's emerging evidence that Alzheimer's may be related to chronic disease in the mouth. Older adults with gum disease are more likely to develop Alzheimer's and dementia. You might have heard of beta amyloid plaques in the brains of those with Alzheimer's disease. That beta amyloid protein might be produced as a response to chronic gum disease infection because those people with more cultured periodontal bacteria tend to have more of this beta amyloid protein in their spinal fluid. So although we don't have a causative link to gum disease and Alzheimer's, it is correlated, and good oral health overall is just a good idea for preventing or limiting the exacerbation of these chronic diseases. So what are some challenges to accessing dental care? Unfortunately, as a caregiver, you're probably uniquely aware of several of these. Um, Older adults are more vulnerable to dental disease. It's a bit unfair that we live as long as we do and we don't get a third set of teeth. So those teeth we got as kids may have had some kind of issue at some point of our life, like a cavity or gum disease. Uh, in older adults, there's a higher chance that you might have untreated dental disease, like caries is the clinical term for dental decay. Same thing with gum disease. And as a senior, this diverse population might be completely independent, which we're not really talking about in this lecture, or completely dependent on someone like you, like a caregiver. So, of those that are functionally dependent, maybe mobility impaired, these are patients that I want to give you some tips and tricks on because it's such a high percentage of those senior adults that require caregivers. So this picture shows someone who's wheelchair bound, which would pose an access to care issue for getting outside of the house, for example, to a dental clinic. But it might also mean something as simple as having like an arthritic wrist or hands that makes it difficult or impossible for you to brush and floss. That's something as a caregiver you're now tasked with doing. And the older you are, the more likely you're going to be mobility impaired, which we know makes it difficult for you to get to the dentist. Mount Sinai is a hospital in New York City that has a robust home health program. So they have doctors and nurses that visit patients who are homebound in New York City. And they did a study with the Special Care Dentistry Association and found that since becoming homebound, a vast majority of their patients perceived a need for dental care that they were not getting since becoming homebound. And that was on average for 3 to 6 years. And as a general dentist, even just a functionally able adult who hasn't been to the dentist in that amount of time is likely to need some kind of gum care. Even if you're a rock star at brushing and flossing your teeth, it's likely you have some tartar buildup somewhere that needs to be cleaned. So this is an important point to note that there's a lack of care here. And of course, with those with Alzheimer's or dementia, it's a mental disability that then affects cooperation and ability to clean your own teeth. And also, I mentioned this before, but it might lead to an inability to express discomfort. I think it's important as a caregiver to understand that even if your loved one or client doesn't realize they need dental care or isn't expressing that they need dental care, it doesn't mean that they need it. There may be a subacute infection that doesn't bother them, or as I mentioned, controlling poor gum care and gum disease has an importance in alleviating systemic or bodily diseases. But despite all these challenges, there are huge advantages to you as a caregiver. It's always important to see the positive. And you have an ability to hopefully control their diet. There are diets and types of foods that do have a direct influence in your rate of developing dental decay. And you as a caregiver have the ability to manage how frequently and how well you can clean someone else's teeth. Whereas maybe this person on their own wouldn't brush their teeth every single day consistently. You as their caregiver can set up a routine, which really does make a huge difference. So the challenge with oral health as a caregiver, I say here with a dementia patient, but anyone who needs to clean someone else's teeth is really in your hands as a caregiver and not with the patient. And there are studies showing that the most significant factor in the oral health of a client or someone who needs caregiving is in the caregiver's ability to take care of their own teeth. So I have to figure out what is your oral health IQ and what is your dental hygiene skill set for cleaning your own teeth? And how can we make it so that you can implement those skills and knowledge in an effective way as a caregiver? So one thing I want you guys to become familiar with, or two things rather, is your loved one's mouth as well as your own mouth. And that's not so you can compare, but it's just because there are two mouths readily available. And as I mentioned, I want you to learn how to take care of your own teeth properly, because that's going to influence your ability to take care of your loved one's teeth really well. So take a look at least once a month, walking you through some things to look for, some bad things, I should say. Swelling or redness shouldn't be present in the mouth. Those are hallmarks of disease or infection. Depending on your coloring, the gums are usually like a pale pink, firm kind of color. The term we use in dentistry is they look stippled because they're almost bumpy. They have like little bumps on them when they're healthy. If they're not and they're inflamed, they tend to look very smooth and shiny. And if you're like me and you have darker coloring, you'll also see different colors in the mouth, like brown or gray gums. That's totally normal, especially in a darker colored patient. Bleeding isn't normal in the mouth. I often encounter patients who are dissuaded from flossing, for example, because when they do it, their gums bleed and they think that's bad. And it's not great that your gums are bleeding, but they're not bleeding because you're hurting your gums. They're bleeding because the gums freely bleed in response to inflammation due to bacteria. And that bacteria is in plaque that should be removed. Sores and lesions in the mouth can happen. You know, if you eat something like a tortilla chip and scrape the inside of your cheek, you should see that scrape heal pretty quickly. And as a general rule of thumb, any sores or ulcers in the mouth should appear and then heal on their own by 2 weeks. But if you see something persistently sore in someone's mouth, that can be a sign of infection, or it could be a sign of something chronically causing trauma. Maybe there's a sharp point on a broken tooth somewhere that's rubbing the wrong way and leading to this painful occurrence. Dentures, which I'll discuss denture care a little bit more, are not real teeth, but they should be kept clean. So if they look kind of funky, like there's tartar or plaque all over them, that's something that should be cleaned off before they're put back in the mouth. And this picture shows some bottom teeth with this like whitish cloud like appearance of substance around the base of the teeth. And that is the plaque we're looking for. So even in your own mouth, after you're done cleaning your teeth, you should see an absence of that whitish film. That film is what hardens to tartar buildup if it's not removed readily. And if it's hardened, that's when you need a dentist or a hygienist to help with removing it. So if you look in someone's mouth and you see that and it's persisting, that's when you should get some help too. Bad breath, we mean like very powerful bad breath. That's a sign of bacteria invading something and causing an infection in the mouth. And broken or loose teeth. Apart from being uncomfortable or painful, these are at a high risk of being aspirated and seeding bacteria, for example, in the lungs, and should be removed as a risk, especially in a homebound or a bedbound patient. Dental emergencies, unfortunately, can happen. This picture shows someone who has a swollen cheek. So swelling in the lip, cheek, or gums is a sign of infection. A chronically infected tooth, maybe one that has a cavity for many years, can suddenly tip over the edge and cause something like this. And this becomes often a medical emergency as well, something that might require antibiotics, and something that, if left untreated, could cause airway and breathing issues, for example, so it should never be ignored. Uncontrolled bleeding in the mouth is not normal. Loose teeth, as I discussed, and pain. Painful teeth, that's a good reason to get something investigated. But again, your loved one might not be able to express that they're in pain. And pain, I should note, is not a reliable marker for needing dental work. Healthy teeth can be sensitive and feel pretty significant pain to innocuous things like cold water. And on the flip side, teeth with giant cavities or chronic infections might never, ever wake up and say hello, but still need to be taken care of because that's chronic bacterial infection in your mouth. This photo shows some bottom teeth, and I want to point out some things here to look out for. We talked about plaque, and that is the whitish substance down at the bottom of the teeth closest to the gums. That's what you want to sweep and remove every single day when you're brushing teeth. You always, and I mentioned the word sweeping, when you're brushing teeth, always use a soft or extra soft toothbrush. Plaque is soft, and so a soft brush will take care of it. Medium or hard brushes are traumatic to the gums and teeth. So don't use them in your client or loved one's mouth and or your own mouth. It's just going to hurt you and it doesn't clean any better. And the technique you want to use is angling the brush towards the gum line and sweeping upwards and using circular motions too. That will also help. If you can see in this photo, the plaque around the gums is leading to inflammation here. There's like a reddish halo around the neck of the teeth, that like upside down, like a U-shaped redness. And that's what we're looking for to resolve by cleaning away the plaque every single day. And this patient also, you might notice this in older adults especially, but even our own mouths, older fillings. I say older, it's still in practice to place metallic or amalgam fillings today, though less and less. They have this silver metal color. So even though it might look kind of funky to you here in this picture, those 3 teeth with the dark gray on them, those are just normal silver fillings. So don't stress if you see that necessarily. Doesn't mean that you shouldn't get a second pair of eyes on it and make sure there's no cavities around it. But those are just discolored or different colored fillings on teeth. So set realistic goals every single day. Consistency is key. You're not going to be perfect necessarily, but you want to tailor your caregiving to whatever your client needs, depending on if they're cooperative with you brushing their teeth, for example, or uncooperative, and how mobile they are. The diet that you can create for somebody and the daily oral hygiene habits are going to be the most important things that you can control. So cavity causing diets. We tend to have an understanding that maybe Halloween candy causes cavities, but if you were to take a tooth, for example, and put it in a bowl of sugar, nothing bad would actually happen to it. What goes on in a mouth is that food of any kind enters and the bacteria gets to work eating it just as you do. Bacteria prefer sugars. They're the most readily broken down or easily broken down substances. And as a byproduct of gobbling up your sugar and food, bacteria creates acid. So it's not the sugar that causes cavities. It's bacteria breaking it down and causing acid that erodes away the teeth. And teeth, and specifically the outer shell of your teeth called enamel, is the hardest substance in your body. But acid can break it down, kind of like washing away a rock or something. And the bacteria, once it breaks down the enamel, it invades further into that broken down space, pumps out more acid, and continues to grow the cavities. So apart from just limiting sugar, you want to limit the acidity of your client or loved one's mouth and your own mouth. So watch out for acidic foods and beverages. What I find is that beverages are really big cavity causers. A lot of the innocent seeming, healthy looking beverages that are promoted as diet or sugar free, unfortunately, they are often pumped up with flavorings and agents like citric acid to make them taste good, that make them just as acidic as, the sugar. Like regular Coke and Diet Coke are both about the same acidity. For example, kombucha is literally a vinegar soda with the same pH as a lemon. And fizziness in drinks is also something to watch out for. Carbonation, the carbolic acid, creates the bubbles. And so that is something that can rapidly cause acid-based destruction of enamel and root structures and cause cavities. So you want to focus on that. On top of that, I mentioned that bacteria gets to work eating at the same time you do. And each time the bacteria get to work, they pump out acid. So if you're frequently sipping on a beverage all day long, your mouth never gets a break from the bacteria pumping out the acid. If you're chronically snacking all day long, same thing. Now, depending on your health needs, it might not be feasible to do this, I understand, but chronic eating is associated with cavities as opposed to having discrete meals in which you can eat, sip on some water, and maybe even rinse with like a fluoridated mouthwash. and return your body, but you return your mouth from an acidic environment to a neutral one. I mentioned xerostomia as a condition that has profound effects on cavity control. And that's because even though it's not perfect, saliva function as a buffer in your mouth. So when you're eating, the saliva moisturizes your mouth and helps you actually chew and navigate it through your mouth and digest it. But it also has antibodies that fight bacteria. And the buffering capability means that it's able to neutralize acid to something more like water, which isn't going to cause cavities. So in patients who see a sudden decline in the saliva quality, they can see a very rapid, profound uptick in cavities. So controlling the dryness with avoiding things like caffeine that exacerbate dryness, and adding in more water and using dry mouth control products will also help. So how should you, as a caregiver, position yourself to brush someone's teeth, for example? I do not recommend standing in front of someone and darting a brush in and out. That's uncomfortable for you, actually, and increases your chance of hurting somebody. You want to mimic brushing someone else's teeth as if you're brushing your own. So when you're brushing your own teeth, you have your hand in front of your face and you're brushing and sweeping. So you want to get behind your loved one, make sure they're not moving around and they're comfortable and that you're comfortable. Your arm isn't propped up too high or anything like that that's going to cause you strain. And go from the back and sweep and gently brush with a soft brush. There are some aids to help with people who have a hard time keeping their mouth open or might not be cooperative. This picture shows a soft but still firm bite block, that white thing that the person's holding, that can help with, if you move it from one side to the other, exposing teeth and keeping the mouth open. Puckering lips around a toothbrush, like the top left photo there with someone with their pursed lips around the toothbrush, that's going to keep you from being able to navigate someone's mouth with a toothbrush. So there are ways to retract the cheeks. They pictured as like a plastic or a metal one that you could probably find on Amazon. Those retractors help gently retract cheeks, from the teeth, so you can gain access to brush. For someone who is cooperative enough to be able to brush their teeth, but has, impaired ability to move around a toothbrush or hold a toothbrush, part of that is just because it's very narrow. So doing something like sticking a tennis ball onto the end of it makes it easier to grasp with an open palm as opposed to like a fine grip. Here's just some pictures of other types of soft bristle brushes that surround the teeth and might make it more efficient for you to brush someone else's teeth or brush your own teeth. I mentioned electric toothbrushes because as a general dentist, I tend to recommend these to anyone who is interested because they are proven to clean teeth effectively in a more efficient way. If your loved one is in particular nonverbal or uncooperative and has dementia and they're not accustomed to the feel of an electric toothbrush, however, this might not be successful, but I think it's always worth a try because instead of physically moving and brushing, these electric toothbrushes actually move and brush for you. So what you can do is place the brush on the teeth and it'll spin and move. And you actually don't want to move it too much because then it's not as effective. You just want to place the toothbrush on your teeth and then slowly advance it along. There are a lot of different brands out there right now, and I have no vested interest in them, nor am I knowledgeable about all of them. But the two major brands with the best evidence and long-term efficacy are Oral-B and Philips Sonicare. And I tend to like the Oral-B just because it's got a tinier brush head, which smaller brush heads are easier to navigate around the mouth in a way that doesn't hurt someone. So something to consider there. And this is a picture of a water flosser. It has a tank that you can refill and it jets out water. It's a great tool for cleaning around bridges and appliances or where there's missing teeth. And as a caregiver, helping to dislodge plaque. You can also use an alcohol-free mouthwash in the tank instead of water. I mention alcohol-free because mouthwashes that sting and burn do not clean any better, and they're not actually very good for your gums. So don't ever get that. It's also uncomfortable to be spraying something that stings at someone else's mouth. Always something that is alcohol-free, maybe has fluoride in it for cavity fighting benefits. And because it can get a little messy, make sure you're having someone bent over a sink or even in the shower to use this. When you look for dental products for yourself or someone else, a good rule of thumb is to look for this ADA symbol. That's that like green symbol on the toothpaste tube there. The FDA checks that, whatever product you use is safe and not going to kill you, but the ADA does have some minimum standards that products have to pass and satisfy to be considered effective. One of the big things is what kind of fluoride content does it have? Flossing is one of those things that's a real challenge for a lot of people to do for themselves, maybe because of mobility issues, or it's just hard to reach in the back of the mouth. You might have seen these floss picks or handles. It's just floss ligated on something. They even have reusable floss handles if you don't want to toss out little plastic pieces all the time, though I recently bought some compostable ones for my daughter to use. And these work just as well as floss. It's just floss, but it gives you better access for sticking it between the teeth. And the technique with floss is that floss is just a way to brush teeth in places where a brush can't reach. So if you have lots of teeth touching each other, this is really the way to clean your teeth. If you're just brushing alone, you're not getting to a big chunk of your teeth and you're vulnerable to dental disease. So the floss, whichever way you choose, you stick it between your teeth, hug it around one side, one tooth, and scrub up and down. Use it as a brush to scrub. Okay. If that's difficult, there are dental specific soft picks that you can use. There's a picture down here of the person's teeth using one that looks like a fuzzy pipe cleaner, and they're made in different sizes so that you can yourself, on yourself or on a loved one, comfortably clean in between your teeth. This might be the easiest way to clean in between somebody else's teeth. I'm using one of these picks or soft brushes. I mentioned mouthwash should always be alcohol free. It should really have the ADA symbol on it and ideally have fluoride. And there are over the counter products with fluoride and xylitol. That's a type of sugar present in like Trident gum and Orbit's gum, which also have the ADA accepted seal. This has been proven to reduce bacteria that causes cavities, and it can help alleviate the symptoms of dry mouth. Lozenges as well. I have pictured here ACT dry mouth because they have fluoride in their products, in addition to things that make it more comfortable to chew and eat if you have a loss of saliva. But Biotene is another brand you can easily find at any drugstore. And there are prescription oral hygiene aids that unfortunately you can't get over the counter, but I think are very valuable, and any dentist or hygienist should be able to help you out with this. Chlorhexidine, or it's sometimes called Paradex. There are different brand names for it. It's a medicated rinse that is very powerful at killing oral bacteria. If someone has acute like swelling of the gums related to gum disease, rinsing with this, or if your loved one cannot rinse, maybe dabbing it on a gauze and placing it around the gums will help. We typically don't recommend it for the general population for long-term use because it's got a funky taste, and it can also cause some surface staining, which most people don't like. But if it's just a cosmetic issue, that might be a really great tool to use on someone who's bedbound, for example, or in a hospital. And the quantity of and concentration of fluoride in commercially available toothpaste is restricted by the FDA in this country. Funny enough, in Canada, there is no such thing. So you can buy these high fluoride toothpaste from like Colgate over the counter. In the US, if you talk to a dentist, they should be able to provide it for you or provide a prescription for it. And these high fluoride toothpaste, again, in your own lives, if you tend to be cavity prone, or if you have a kid with braces, I always recommend using these because the amount of extra buffering capability and cavity fighting capability that these high fluoride toothpaste has is really profound. What you want to use is just a small amount, like a pea-sized amount, brush everywhere. You or your loved one can spit out any excess. It's okay if they can't. Small amounts of it swallowed is fine. And in fact, I always recommend not rinsing off this toothpaste. And in particular, with the high fluoride toothpaste, they usually have it listed on the instructions to not rinse it off. And that's because that fluoride lingering around in your mouth can continue to fight cavities, especially while you're asleep, and it continues to buffer your mouth. So if you have a patient who is not cooperative, in a nutshell, you'll have to get creative and get to know them and see what is going to work for them. Having clear communication. There's a concept in dentistry called tell, show, do. You want to tell someone what you're about to do, like brush their teeth. Show them, maybe by demonstrating on yourself or something else around you, and then actually follow through and do that in a clear way. And that provides reassurance. You should pick the right time and right place. If mornings aren't great for brushing teeth, try after lunchtime. Again, just the consistency is what you want to look for. Though I would say that when it comes to oral care, if you have to pick any time to brush or floss, I would always suggest you do it at the end of the day after you're done eating, so your teeth are clean while you're asleep and your mouth is closed. And of course, just be patient, not only with your loved one, but with yourself. You can try, for example, with someone with dementia who in the past might have brushed their own teeth, you can try and engage them with the activity you're doing by, say, giving them a toothbrush to hold on to while you're brushing, so it doesn't feel like such a foreign outside sensation happening to them. And distraction is always great. Put the TV on, put some music on, the radio on, whatever it would take to distract from something that could be unpleasant, like you brushing their teeth. You can also engage them yourself, you starting and having them finish. Dentures, although they aren't teeth, should be brushed. This picture shows a denture brush. It's just a bit bigger and might make it a little faster to clean the dentures. But if you don't have one, that's fine. A regular toothbrush will do. And you just want to brush it every day with soap and water. Strangely enough, toothpaste is pretty abrasive, so don't use toothpaste. You also don't need to soak it in any special denture cleaners. Just cold water, regular hand soap brushing every day will work. If you feel the need to disinfect the dentures, you can mix up 1 part of bleach to 10 parts of water and soak it. And then, of course, clean that off thoroughly afterwards. Always store dentures when not in use in a case. Unfortunately, people, if you stick it in a pocket, it's likely to get tossed out, or it could be damaged if it's dropped and broken. So always take care to, especially if your loved one's in a facility, to not lose the dentures that way. And dentures need a break from your mouth. The analogy I use is it's like wearing shoes 24/7. Things would get kind of funky in there. And so if you leave the dentures in overnight, it could lead to a yeast infection and irritation and soreness that can be treated with like a topical antifungal, but should ideally just be avoided by giving at least 5 hours a day without wearing the dentures. So the best time is usually overnight. And the way you want to insert and remove dentures, upper dentures, whenever you're putting them in, for example, they cover the roof of the mouth and they stick to the roof of the mouth by having good surface contact, and you need moisture for that. So always make sure there's a little bit of water underneath the dentures before you stick them in. And once they're stuck in, depending on the nature of those dentures or the quality and the person's mouth, they might be pretty retentive. So the way you want to break the seal is by pinching the front 2 teeth and tipping upwards. That tipping force is what's going to dislodge the seal and cause it to come out. This is usually a thing with top dentures. Bottom dentures tend to be on the whole pretty loose, unless the person you're working with has implants and little buttons that fasten into the implants. Those will be a bit more retentive, but again, tipping on them will remove them so you can actually clean them. If your loved one is missing only some of their teeth and not all of them, they might have what's called a partial denture. They often have a metal framework and metal clasps that hang onto the teeth that are existing, and that's the retention point with these. So no tipping here. You want to put your fingers, ideally find the clasp. There's going to be a clasp on both sides of the mouth, rarely on just one, and push down for upper dentures, push down on the U-shaped part of the clasp to dislodge its retention, and push it down. And same thing for bottom dentures, push up on the U-shaped part of the clasp, and that'll take them out. And partial dentures too need to be removed every single night. So where should you look for professional care? You could always talk to your own local dentist and see if they have resources. Most dentists don't operate in a vacuum and have friends, and even might be able to accommodate someone in a wheelchair or make a house call for you if your loved one is a long-term patient of theirs and needs, say, a denture adjustment or something simple like that, or just to look around. But I did a quick Google search. I'm unfortunately based out of California. I don't have as many resources about Virginia to share, but I did a Google search and found that there are teledentistry practices and house call dentists in Virginia that you can call upon. Teledentistry just means doing something like this, a Zoom chat with a dentist that would be helpful for triaging when your loved one needs dental care. Oral and maxillofacial surgeons, they are specialists who went on to extra training. They're the ones who take out wisdom teeth, for example, but they do a host of other procedures. The reason I mention them is they often have extra training to provide sedation, and often also have operating room privileges at local hospitals. So if you have an uncooperative patient who needs a tooth pulled or has a broken tooth, they would be able to help provide comfortable care in this way. Their offices also tend to be, I want to say, more accommodating to wheelchairs, for example, because surgical suites tend to be larger. The only limit to this is that their scope of practice isn't to do cleanings or to fill cavities. It's really just to remove teeth. But when we're talking about resolving things that could cause pain or infection, that's really a big part of it, is removing teeth that are no longer serving a person. And sedation dentistry, dentists that can provide sedation either themselves while they're doing work, or they employ an anesthesiologist in the office. This is a way, even for a cooperative but maybe homebound patient, to get comprehensive care, where it's not possible to come in for 5 or 6 appointments to take care of so many cavities. They could have one lengthy appointment under sedation and get all their dental needs taken care of at once. And then from there, have just kind of continuing preventative care services at home. And sort of related to that, if you're near a major hospital center or a school, they might have this type of sedation dentistry also available in a hospital. Overall, though, I want to emphasize it can be difficult to find this. So talk to your own dentist, consult the state or county local dental societies. They would have resources for you. Special Care Dentistry Association is just a group of like-minded dentists who tend to focus on special needs dentistry for people who fit outside of the box of conventional private practice dentistry. So that includes homebound, dementia, or even just plain geriatric dental care. Looking into their resources and seeing if there's a dentist as part of their membership near you would also help. So I hope I have enough time right now to answer some questions. Yeah.
Thank you, Dr. Mathai. So
Yeah.
appreciate this great information. I'm like, whoa, I got to do this because I'm a caregiver too. So
Yeah, I
never
figured.
know.
Great.
Well, folks, at this time, you can ask questions in the Q&A box, and I will address them while we have a few minutes left here. We did
Yeah.
have a question come in about fluoride.
Yes.
It's very controversial, apparently, whether to use fluoride or not. Can you
Yes.
explain why we should use fluoride versus not?
Yes. I'm glad you brought that up. I should have addressed that. Fluoride is a naturally occurring mineral that they actually found it in like high amounts in well water in the Midwest and found that those people drinking that water had a lower incidence of dental cavities. And that was like in the 40s or something. And that's how we started developing policies and using fluoride as something to prevent cavities, both in like putting fluoride in the community water and in toothpaste. So there's a lot of controversy these days about fluoride that unfortunately aren't really based in a lot of evidence, because there's more decades of evidence of it being really helpful. For example, something as simple as adding fluoride to the community water, which we still consider a suboptimal amount of fluoride for cavity prevention, but that alone they can see in kids' teeth that are developing and onwards, the amount of dental decay reducing dramatically. So I mentioned earlier on in the PowerPoint about how more adults are aging with more of their teeth. And in a big way, it's because of fluoride. But if you have, and I think the controversy is people sometimes just don't like the idea or the thought of like a public health measure that is applied as a blanket whole to everybody that they have no choice in. So that's where some of the controversy is, especially with community water fluoridation. You don't want to be swallowing tubes of toothpaste. That's harmful, but a little bit of fluoride is not proven to show any harm, and it really does help. Fluoride also, in addition, the way it works is it remineralizes enamel that's broken down by acid. And when that incorporates into the mineral of your enamel, it actually makes the enamel stronger than it was before. And fluoride itself also kills bacteria, which is why we're so big on it. But there are other things if you're really concerned about fluoride. There are other products. There are toothpaste with calciums and phosphates that also can deposit mineral. There is a new product with emerging evidence that it might be as effective as fluoride, though again, we're a long way from figuring that out. But it's present in a lot of toothpaste. I can't think of any of the brand names off the top of my head, but it's called nano hydroxyapatite. So it's often, it's called nano HA, and you might find that in a lot of fluoride-free toothpastes. So if you are getting a fluoride-free toothpaste, make sure it has that, because otherwise there's really no point in using toothpaste. The whole point of toothpaste is a delivery mechanism for that medication. Yeah.
Got it. Okay.
That helps.
There's someone else shared that it feels almost too late since the gums are almost non-existent. How do you encourage people it's not too late to get their teeth or gums fixed when it's been to a certain?
Well, too late means a lot of things. Maybe you mean like it's too late for the teeth. Yes, you might need to remove teeth, but that's still a huge positive, because remember, these teeth that are not healthy aren't just teeth that aren't healthy, they're teeth that are making your whole body sick too. So it's always important to try and reduce the amount of chronic inflammation in your body and your mouth for your own comfort, and also just for your overall health.
Thank you. Another question, someone put LO, which may mean little one, has terrible bad breath. Any suggestions?
Take them to a dentist, see if there is an infected tooth that's leading to that. Little kids can build up tartar. As a general rule, we don't see that as much in little kids, but that's also a bit, my practice, I think that's a little off. You can still have tartar buildup and signs of early gum disease that need to be treated. And
Another question, do you recommend sedation for people with dementia? Doesn't sedation worsen dementia in some people?
Yes, that is an important part. And I could brush up on my knowledge of this, because heavy sedation has been associated with just maybe like brain fog afterwards. I think you have to weigh the pros and cons. One thing too regarding dental care is that we typically don't sedate people for dental care. We use local anesthetics. And so when we're sedating someone for dental care, usually the dentists and surgeons are still using local anesthetics, so they're numb and technically can't feel anything. They're just using a light form of sedation, so they're not aware. It's very different than when you're putting someone really under for like abdominal surgery or something like that. So it's much less. And so that tends to have a better outcome, and better recovery from that standpoint.
Mm.
Yeah.
Another question is using electric toothbrush.
Yeah.
Does the toothpaste on the brush diminish as you brush from tooth to tooth?
Technically, but I wouldn't worry about that because again, the fluoride and the toothpaste in the mouth is buffering all around.
Okay.
So don't worry too much about that. You actually, I think in like toothpaste ads, that's where we get it from. There's like that beautiful like swoosh of
Mhm.
toothpaste along this long rectangular toothbrush, and that's a little too much. You don't need
Okay.
that much.
It's
Just
just a
like a
pea
little,
size, right? Pea
yeah,
size.
like a little ball is fine.
Okay, okay. Another question. What is your stance on salt water gargles or peroxide plus water rinse?
I think those are great things as mouthwashes. Salt is readily available. The reason that's helpful is because the salt actually breaks down bacterial walls and makes them explode. So it's a natural antibacterial and very gentle mouthwash.
Mhm.
And peroxide as well is also great. That's actually present in some commercially available mouthwashes. Again, I don't care about brands, but I know there's a Colgate one called Peroxyl. That's basically that. And it does help with gum disease.
Mm.
Yeah.
Um, how does insurance work when it comes to sedation? I've heard dental sedation is covered in the hospital, but not in a dental office. Is there a different anesthesia used in the dental office versus the hospital? Asking for someone who has an adult son with high-level autism who cannot sit or follow instruction.
Yes. So this is one of the access to care issues is just the finances of it. Dental insurance isn't medical insurance isn't perfect, we all know, but dental insurance is really just like a benefit plan or a discount plan. It doesn't cover everything and it doesn't cover anything medical. So most dental insurances, and I can't speak to all of them because it depends on the plan and just reaching out to them and seeing what they would do for someone with autism and needs specialized care, but they often don't cover that. And as a dentist, you're often not billing to a medical insurance plan, and a medical insurance plan might not cover services that are done in a dental office. So
Mm.
this is where the hospital and hospital-based dentistry might help. I think sometimes for more vulnerable senior populations, depending on the facility, a dental office isn't as medically equipped as like a surgical center, for example, or a hospital, so it can be safer. But the hospital usually would be able to bill to even like Medicaid or Medicare, and that might provide some medical coverage. So you're right. But the only way to know that for sure is to talk to the person providing the care and see what can be done.
Mm.
Because a lot of the private dental offices that offer these services are employing anesthesiologists that come to them that have to be paid directly. You can investigate with your insurance if it's a PPO'd insurance, medical insurance. They may allow you to take a bill from the anesthesiologist and submit it for reimbursement, for example.
Mm.
So it's unfortunately a lot of just like homework.
Yeah, yeah. And we had a comment that said, I recommended my coworker to see my chiropractor, and she was told to see her dentist before she could be worked on. My chiropractor is also a kinesiologist and neurologist, so my coworker was quite surprised to be told to see her dentist.
Specifically from a chiropractor, I can only imagine. I'm not sure I often get people going to chiropractors for TMJ issues. That's your jaw
Mhm.
and pain. And they can often do wonderful things with massage and stuff to help with alleviating jaw pain. But
Mm.
eliminating the source of it is something dentists can often help with. Yeah.
Okay, okay. Well, thank you so, so much again, Dr.
Yeah,
Mathai.
this is fun. Thank you for having me.
Oh, thank you. Thank you. And I want to thank our audience too for being with us for the past hour. Really appreciate everybody's time.
Yeah, very
And
good questions like
yeah,
that.
these are great
Yeah.
questions.
Yeah.
Terrific. And so, folks, I just wanted to also ask you if you would like to come to our next webinar. You're welcome to join us in October. We're going to be doing Medicare 101, and that's going to be on October 16th. We're going to do Medicare 102 the following week on Wednesday, October 23rd. So you're all invited to join us then. We did get one more question, if the
Yeah.
video will be available. Yes. So everybody, this is getting recorded. So you will have the video directly emailed to you within a week. And we'll also have this on our YouTube playlist and on the Fairfax County website. But I want to remind everyone to please fill out that survey. We love to hear your thoughts. You can leave comments for the doctor, and let us know what you're interested in for next year's programs, because we do create these programs off of what you would like to see. So again, Dr. Mathai, thank you again so much for your
Yeah, you're
time.
welcome.
So appreciate it. Thank you again to our audience, and I hope everybody has a great afternoon and
Yeah.
take care. Thank
All right.
you.
Bye, everyone. Thanks.
Bye-bye.